Depression is a serious medical condition. It affects millions of people around the world. In fact, it's the leading cause of disability worldwide. This means depression prevents more people from working and living their lives than any other illness. It's important to understand that depression is not a sign of weakness. It's a real illness with real causes. Many people experience sadness or low mood occasionally. This is a normal part of life. We might feel down when something bad happens. For example, we might feel sad after a relationship ends or we lose a job. These feelings are usually temporary. However, when these feelings of sadness last for a long time and start to interfere with our daily life, it could be depression. Depression is more than just feeling sad. It's a serious condition that affects our thoughts, feelings, behavior, and physical health. It's important to remember that depression is treatable. With the right help and support, people can and do recover from depression and live full and meaningful lives. We all experience sadness from time to time. Sadness is a natural human emotion that we typically feel in response to difficult or upsetting events. It's that feeling of heaviness in our hearts, the urge to withdraw, and the loss of interest in things we usually enjoy. Depression, on the other hand, is different. It's not just a passing feeling. Depression is a persistent state of low mood and loss of interest that significantly impacts our ability to function in daily life. It's like a dark cloud that lingers for weeks, months, or even years, casting a shadow over everything we do. While sadness is usually triggered by a specific event or situation, depression can sometimes appear without a clear reason. It can make even simple tasks, like getting out of bed or taking a shower, feel overwhelmingly difficult. It's important to understand this distinction because it helps us recognize when we, or someone we care about, might be experiencing something more serious than temporary sadness. Recognizing the difference is the first step towards seeking help and finding relief. Depression can manifest itself in many ways, making it tricky to recognize. It's not always about feeling constantly sad. Some people might describe it as feeling numb, empty, or hopeless. Others might experience irritability, anger, or restlessness. To help identify depression, mental health professionals often refer to a set of symptoms. Experiencing 5 or more of these symptoms for at least 2 weeks could indicate depression. These symptoms include persistent sadness or low mood, loss of interest or pleasure in activities you used to enjoy, significant changes in appetite or weight, difficulty sleeping or sleeping too much, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating, thinking, or making decisions, recurrent thoughts of death or suicide. If you're experiencing several of these symptoms, it's crucial to reach out for help. Remember, you don't have to go through this alone. Section 4. Depression's impact on the brain. A look inside. Depression isn't just all in your head, it has a real physical impact on the brain. Scientists have discovered that people with depression often have differences in brain structure and function compared to those without depression. For example, areas of the brain responsible for mood regulation, such as the hippocampus and prefrontal cortex, may be smaller in people with depression. These areas play a crucial role in processing emotions, forming memories, and regulating stress responses. Furthermore, depression disrupts the balance of neurotransmitters, the chemical messengers in the brain. Neurotransmitters like serotonin, dopamine, and norepinephrine are crucial for mood, motivation, pleasure, and sleep. Imbalances in these neurotransmitters can contribute to the development and persistence of depression. Understanding the physical changes in the brain associated with depression highlights that it is a real medical condition, not simply a weakness in character or a lack of willpower. Section 5. Seeking help and treatment options. Seeking help for depression is crucial for recovery. The first step is often talking to a doctor or mental health professional. They can assess your symptoms, make a diagnosis, and recommend the most appropriate treatment plan for you. Fortunately, there are effective treatments available for depression. These include therapy, medication, and lifestyle changes. Talking therapies such as cognitive behavioral therapy or interpersonal therapy can help you identify and change negative thought patterns and develop coping mechanisms. Antidepressant medications such as selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors can help regulate neurotransmitter imbalances in the brain. Engaging in regular exercise, eating a healthy diet, getting enough sleep, and managing stress can also play a significant role in managing depression. Remember, there is no one-size-fits-all approach to treating depression. The most effective treatment plan is often a combination of therapies tailored to your individual needs and preferences.